Why are people so afraid of birth? Why are we approaching birth with such tension, such fear? And how does that impact our ability to birth? And then how do we get rid of that?
Better care, better outcomes for women. This is the AskOBGYN Network.
Welcome and thank you for listening. I'm Bill Chun, board certified OBGYN. AskOBGYN exists because we believe women's health is the backbone of our society. That's why we're all about providing you with the knowledge and support you need so you can advocate for yourself and get the care you deserve. Today, I'm excited to have Kaleigh Daigle.
Hi, excited to be here.
An amazing doula. Kaleigh's here to talk about hypnobirthing. And I want to say that I was honored to witness this, Kaleigh as a patient and some of her, would you say students or clients? Clients.
Yeah.
Yeah. Because it's just amazing, you know? I think prior to hypnobirthing, my idea of childbirth education was really Lamaze. Bradley, I don't know about Bradley. I can't really recall any patients who did Bradley method, but Bradley method is mentioned as well.
Yep.
So what I like to do today is talk about hypnobirthing.
Yeah, I'm excited.
Right?
Yes.
This really is, I think, a trend. Recently, all the patients that I've been seeing, they certainly go to you, but they've been working with you and others about hypnobirthing. I've had few patients who've gone to other hypnobirthing classes and they're all intent on the same thing. So before we talk about hypnobirthing, let's talk about Lamaze. Lamaze is kind of interesting in that I think we think about Lamaze, breathing, exercise, natural childbirth.
Yep.
Its history is interesting in that it was started by Dr. Lamaze, Dr. Lamaze, who was a French obstetrician, and he witnessed in Soviet Union in 1950s, all these Russian women having natural birth without any intervention. And I think about Russia in 1950s, this is after horrible World War II. Yep. This is a communist country, Stalin ruling. They probably didn't have much option.
Right.
Right?
Yeah.
So, and then he brought this method to France, and the founder of Lamaze International, Marjorie Carmel, wrote a book called Thank You, Dr. Lamaze. And then this became an entity in 1960 with, I think she founded a society with German physical therapist, Elizabeth Bing, who herself has a history in that she was Jew, which woman, she escaped to London or England, and then there she got trained as a physical therapist, and she partnered with Marjorie Carmel and studied Lamaze. And I think many people, when they talk about childbirth class, they're thinking Lamaze.
Yeah, that's, usually what comes to mind for a lot of people. I especially find that when I talk to like my mother-in-law and my mother, I think that was really popular when they were having their babies.
Yeah, I think 60s and 70s, I think this was it. And then in the 80s, 1970, when the C-section rate was 1 out of 20, I think this was still in place. And then in the 80s, when epidural became more popular, techniques got evolved and became more readily available, I think then, of course, cesarean section just took place. Yep. The other method that comes about here and there is Bradley method. Bradley method is interesting in itself, found by Dr. Robert Bradley, who went into obstetrics in 1947. And the story behind this is that he grew up in a farm and he witnessed a lot of mammals giving birth. And he thought, gee, if mammals can do it, shouldn't our women do the same thing? Because in 1940s and into 50s, the popular method was that twilight regimen you probably heard about, right? Yep. Morphine and scopolamine regimen. Yep. And then this is when a lot of babies were born with forceps and whatnot. Yeah. So aside from some of the common theme with Lamaze, I think Bradley method is different because it really emphasizes father figure as a coach.
Yep. Yeah. And that's really important in hypnobirthing as well. And it's interesting kind of listening to some of the history of Lamaze and Bradley, in that a lot of the curriculum and the theories and the philosophies that hypnobirthing is founded on is similar. The woman that created hypnobirthing, Marie Mongan, her interest in birth and looking at it in a very natural way started as a very young child when she witnessed a cat giving birth in her backyard, and seeing this cat give birth in a way that was so calm and gentle and didn't need really any intervention or help. And then a predatory animal came into the yard and this cat's labor just stopped. And the cat was able to get up and move away and get to safety. And it really kind of made an impression on her and got her thinking of like, okay, we're animals too. What happened with this cat and how does that relate to, women giving birth in this modern society where fear is part of it. And then also, another thing that heavily influenced hypnobirthing was Grantley Dick Reed, a famous obstetrician who witnessed women in England, both during the war and then after the war, giving birth in a very easy, gentle way, and kind of trying to figure out what did these women have that the other women that he worked with that appeared to have very painful births. What was different there? So it's interesting to kind of see some of the similarities in the three programs.
Yeah. So did you use hypnobirthing for your
I did. I used
first one?
Yep.
I know you did with the second one because I was there.
Yes. So I have two boys. And I used hypnobirthing for both births. And it's kind of funny, if you talk to anyone that knew me before I became a mother, I was the type of person that was completely terrified of any type of medical procedure being done to me. I was fine if I was around someone else having it done to them, but for me to get blood drawn, I would pass out. So when I got pregnant, I was terrified. I remember having the pregnancy test there, and obviously at first I was excited, but I was literally trembling thinking about, I have to get this baby out of me, and what am I going to do? I was afraid of the idea of getting an epidural because the needle freaked me out. I was afraid of the idea of having a natural birth. So to kind of be on this journey and have the births that I did, it wouldn't have been possible without the tools and the techniques that I learned in hypnobirthing.
I think I remember the moment I walked into that room and you were in your zone, you had Mari and you had your support team. Mm-hmm. I mean, I knew you heard me and other people talking, but you somehow just created that place where you were able to separate. It's someone's like out-of-body experience. And I know I'm going to ask you more questions about this, but as an obstetrician, I think I was just an observer, right? I just had to watch you do your thing and just make sure the baby doesn't hit the floor, which is really what I think my role is, especially in your case. So I think it's good for listeners to really understand what hypnobirthing is all about. I know this course is taught over 5 classes.
Yep, it's a 5-week series. It's about 2.5 hours each week. And it's that long because we cover so much material. So there's not only the education portion of it, which is evidence-based. We talk about what's happening with your body and what's happening with baby. And we look at it from, it's the program isn't about science, but the facts that we share, it's evidence-based. So you learn a lot about birth and what's happening, the hormones that come into play with it, the anatomy and the physiology of it. But we also really work to look at, why are people so afraid of birth? Why are we approaching birth with such tension, such fear? And how does that impact our ability to birth? And then how do we get rid of that? So, after the first week of class, we don't use the word pain anymore. We don't use the word contraction anymore. When we have that random person come up to us and tell them their horrible birth story, and it might not even be their birth story. It might be their mailman's wife's birth story, but they just feel the need when they see a pregnant belly to tell them how awful it's going to be. So we stop listening to those, and we really start to work on deprogramming ourselves from everything that we believe about birth. And then we start replacing that fear and those myths with evidence and then with techniques. So hypnobirthing uses the term hypnosis, but really it's more of like a deep relaxation, guided meditation that we use. So we work on that. We work on breathing techniques and just learning how to approach this with joy and excitement rather than fear and dread. and do it so our body is loose, limp, and relaxed. And we're, if you think about it, people have been having babies for thousands and thousands and thousands of years. And just only recently has it become something that needs so much assistance and so much help from professionals. And, people had babies in caves. And if it wasn't possible, then we wouldn't be here as a human race.
I think that's a very good point. Whether it's Bradley Lamaze or hypnobirthing, all of you really say this is a natural process. So one, letting it happen when it's ready.
Right.
And moving about during labor and just being in that place. Even Dr. Bradley mentions that it's about finding that calm, quiet place, solitude, having your eyes closed as if you're asleep. I think sometimes people think hypnobirthing, does it mean I'm under hypnosis? It's more like me watching my favorite movie, kind of. I'm engrossed in the movie, right?
Yeah, I like to equate it to daydreaming, really. It's not hypnosis is what most people think of, the guy up on the stage with the pocket watch that makes you cluck like a chicken. You, at no point under the hypnosis that we use during hypnobirthing, lose control of your body. No one can make you do something that you don't want to do. You're not unaware of your surroundings, but you're kind of at a place where you don't really care what's happening outside of what's going on within your own body. And it becomes very instinctual. So I use the example if, everyone's done it at some point where you're driving a route that you drive every day. Maybe it's from work to home. And during this drive, you're just kind of off in your own thoughts. And then you get home and you don't really remember the drive. You know that you got there, you did it safely, but you were so lost in thought the whole time that you don't remember turning your signal on and getting off in the exit. You don't remember turning down your street. Your body did those motions because it's something you know how to do. But your mind was somewhere else. And it's very similar to kind of what happens during hypnobirthing.
Sounds like I should take the class.
Yeah.
Really, I could use that, like when I'm in a busy grocery line and I'm a little stressed.
I mean, honestly, I use some of the techniques and the breathing and the, that hypnosis, if you will, in parenting all the time. I always tell my students getting the baby out is the easy part.
Yeah.
Parenting and taking care of them, that's the challenging part. And I mean, it's so rewarding, but it's so challenging. So having those tools that I learned when I took the class and now when I teach it, I use it all the time. When I can't sleep, when my toddler, flushes something down the toilet they shouldn't.
So typically, when do women start? At what gestational age?
So we really recommend that they start in their second trimester. With the method, we do a lot of practice in that getting into hypnosis or relaxation and guided meditation. And it's really a muscle memory thing. So the more you practice it, and the earlier you start in your pregnancy, the easier it is for you to then go into that super relaxed space when you are in labor and things aren't your norm and you're outside of your element. So building that muscle memory starting second trimester is a great place.
I think that makes sense. I always tell patients around 19 to 20 weeks by the time they've had their feeder survey.
Right.
And I actually want to qualify my statement because I, like many of us, we do all these tests, including feeder survey at 19 to 20 weeks, which some may say is not needed, right? But in at least around Boston, I think many of us do that.
Yep.
And then after that, I think for the most part, people are in a safe window. That's when they start shopping around for childbirth educator to pediatrician and whatnot.
Right.
So 5 sessions, 2.5 hours each. And then is there like take home material for them to practice with?
Yeah. So when you take the class, you get a book which kind of outlines everything that we go over in class. They get a CD or now they don't do CDs anymore, but it's a digital download and it's something called the Rainbow Relaxation. And it's about 20 minutes. It's a guided meditation that you do practice every night, which helps you learn how to go into that super relaxed state. And it's really positive. There's a lot of visualization, visualizing yourself having an easy, comfortable birth, visualizing your body doing what it needs to do, visualizing your baby doing what it needs to do, visualizing yourself after you have the baby, and what does it look like in that room, and how do you feel, and what does your baby look like, and is your partner there with you, and just replacing all those negative thoughts that we have with all of these wonderful positive thoughts about this experience, because it's going to be one of the happiest days of your life.
The happiest.
The happiest. Well,
The
it depends
most
on how many
amazing.
kids you have.
Yeah.
You got to share that day. But yeah, so there's that. There's also an affirmations track. So we talk a lot about some of the laws of the mind, and we can't hold a thought about, two opposing thoughts about the same subject at the same time. So we can't think in our head, wow, birth is going to be amazing and I can do this and it's going to be comfortable and I'm going to achieve this natural or unmedicated birth. And at the same time think, well, this is going to suck and it's going to be awful and it's going to be so painful. You can't think those two things at the same time and truly believe them. So with the affirmations, we're repeating over and over and over again these positive thoughts and trying to make those the ones that stick in our mind rather than those negative thoughts. And with enough repetition, you do this while you're in that, meditative or relaxed state, allowing it to kind of sink into your subconscious. The more you hear it, the more you're going to believe it.
I tell my patients when we talk about my short education about labor pain management that really there is no one way of doing this, right?
No.
And especially about epidural, I don't see epidural as that evil. It's just a tool.
Yeah,
For some, they need it.
And
Others don't.
I don't either. And I think, the goal of a birth experience should be one that is comfortable. You should not be suffering at any point. And, something that you can look back on and have positive emotions around. So, the curriculum of hypnobirthing gives you all the tools. And if you can approach it with the right mindset, I personally have experienced birth that I did not use an epidural, and I never at any point felt like I was suffering. It was intense, but I wouldn't describe it as painful. But I also think, it gives you the tools to, if you come in, you're calm, you're relaxed, you're enjoying your experience. And then you get to the point where, okay, this is no longer a positive experience for me. And now I'm starting to suffer. Let's get the epidural. Let's make sure that this continues to be a positive experience for you.
So I think like anything in life, it's about the process, not the end result.
Exactly.
I remember there was a client who went through your class, hypnobirthing, and she had one of your fellow doulas. And you know what? I have to say, I hate to admit it, but I didn't think she could do it.
I think I know exactly what you're talking about.
And when she was about to deliver vaginally and she was doing so well, I remember your friend and I, we looked at each other and said like, holy, you know what? Because wow, this particular client listened to your lectures, practice obviously, and did something that I was shocked.
Yeah, she was amazing. And I talked to her after the fact, and I don't know if I realized in class how much time and dedication and how much she really put into the class, but talking to her after, she really worked hard at it, and she was so happy afterwards. Yeah. And, she looked back on that experience in such a positive way. And that's a huge win for me.
And I think for many women, it's not unusual. I think it's fairly common. I have these first-time moms who are quiet, shy, timid. And when they come back for postpartum visit, they're like, whoa.
Oh, yeah.
They're totally different, right? They're confident. They speak more. They're more engaging. Yep. So it is a major achievement.
I can remember just personally, I've never been someone that was very physically good at things. Like I was never an athlete. I never excelled in any of the sports I did. And, I wasn't really great at working out or anything like that. And I remember having this amazing birth experience and, just the physical part of it, the emotional, the mental part of it. I remember having that baby and being like, I did that. And I felt so proud of myself. Right. I've never felt so good at anything as I did when I had that birth experience. And I honestly think that really helped me in the postpartum period as well. I mean, as a new mom, you don't know what you're doing. It can be overwhelming. You second guess so much. But I feel like I had this experience and I did it myself, and I knew what I needed to do to get my baby there safely. And I feel like that helped me kind of continue that thought process as I was navigating those early weeks of parenthood.
That's a very good point. What percentage of your patients who went through hypnobirthing would say deliver vaginally versus cesarean section?
Honestly, I don't know, but it's way less than the 1 in 3, which is the national average. I mean, maybe 1 in 6.
I mean, that's 50% improvement.
Yeah. I mean, we talk a lot in class too about interventions and how to approach them. And, sometimes interventions are needed and they're necessary. And, hypnobirthing isn't about just saying, no, I don't want any of these interventions, but it's about, okay, let's talk about this intervention. What are the benefits of it? What are the risks of it? Okay, if we don't want to do that just yet, what are some alternatives that we can look at? What is your instinct telling you, your gut? And then what happens if we do nothing and we ask for a little bit of space and a little bit of time? And I think, sometimes people think asking these questions might offend the doctor or might offend the nurse. And they're afraid to ask them, or they think they don't have a say. But I always say, you are part of your healthcare team. You are part of your baby's healthcare team. And
no, you say you are paying for this.
Yeah,
and you got to act like a consumer. I mean, this is what we're all talking about.
Yeah.
Because I know if they went to hair salon, restaurant, anything else, you're going to demand service.
Right. Yeah.
And for whatever the reason, the labor and delivery in the hospital, people act timid.
Mm-hmm.
Classic example we talk about in terms of intervention is gestational hypertension.
Mm-hmm.
I just had a patient who was diagnosed with gestational hypertension, and she was brought in, I think, just the right time because she delivered in 10 hours with induction.
Great. That's
versus
amazing.
Same patient under someone else's care
Maybe
could have
a
been
week
3 to 4
earlier.
days.
Yeah.
So this all goes back. I was thinking as I was reading about Bradley Lamar's hypnobirthing and whatnot, they all fit into our acronym SCREAM.
Yep.
Really does.
Mm-hmm.
It is that finding right doctor, being able to communicate.
Yep. And we talk about that in class too. Choosing someone that has a philosophy on birth that aligns with yours. They use this really great analogy of if you were working for a big company and that big company wanted to start this massive project and they put you in charge of hiring the overseer for this project. Would you hire someone that said, I really believe that the objectives of this project are flawed and it's probably not going to work, but I got a great personality. I have tons of years of experience. I've never had a negative outcome, but this project is it's flawed. Would you hire that person? No, you're not going to hire that person. You're going to hire someone that believes that this project is going to work and that you're going to have a success. So you don't want to hire someone that says, yeah, birth is natural, but we need to do all these things to help it along. We need all these interventions to make it work. You're going to want to hire someone that says, yeah, for a healthy mom and a healthy baby, birth is natural. Birth is a normal thing. And like you say, I just need to stand back and watch and make sure the baby doesn't fall on the floor.
Exactly. I mean, simple take-home message from today's podcast is if you're pregnant, do hypnobirthing because
we
can reduce your chance of C-section by 50%.
Yeah.
That's just, why not?
And it's about your experience too. It's taking it from something that's this medical event to a really bonding experience for you and your partner. We give you so many tools for partners to work together, and it's not just about what's happening to mom's body. It's about what's happening, but how do you impact that and influence it and make it feel better and make it an experience that's positive. And, we encourage, couples to do this class together. It's a great bonding experience. It's a great way to get excited about the birth of your baby. We have a whole section that we talk about prenatally bonding with your baby and talking to your baby and how important that is to the experience, because mindset is such a huge factor in having a comfortable birth.
I think having tools to really relax and understand letting it happen, especially towards the last 2-3 weeks when you are really done, I think is going to keep those stress hormones away, help your blood pressure, heart rate and whatnot, really just allow to get through one day at a time.
Right.
Stress management, whether it's pregnancy or anything else, it's really key.
Yeah.
And a lot of first-time moms, what do they say? 37 weeks. When is the baby coming?
Right.
I don't know. Well, Chun doesn't know much. Well, that's true because I don't know.
Yeah. If you knew, you'd be very, very rich.
You know, another trend that I've noticed really is that a lot of partners getting involved.
Yep.
So certainly during labor and delivery. And after, I'm seeing a lot of partners, both male and female partners, doing the skin to skin.
Yeah, we talk about that in
which
class
is
a lot.
incredible, right?
Yeah. Yep.
I saw, you know, this very happy father the other day. He was a sturdy gentleman and saw this little baby on his chest. It was amazing.
I have pictures from both of my sons' births of, you know, after I had my turn with my skin to skin, you know, pictures of my husband with our sons on his chest. And it's just one of my favorite pictures of him and our babies. And it makes me like emotional thinking about it and what a special moment that was. And I'm so glad that he took the opportunity to do that.
So if hypnobirthing is so effective, why aren't more people doing it?
I think the name can kind of be a little bit of a turnoff. I think people don't quite understand what hypnobirthing is about. I think there's a lot of misconception that it's only for home births. It's only for giving birth in the water. And none of those things are true. You know, most of the people that I teach have births in the hospital. Most of them do not birth in water. And I think, you know, we talked a little bit about people think of hypnosis of that guy up on the stage and with the pocket watch and clucking like a chicken. And it sounds just kind of out there to them when really it's not. It's really about mindfulness and learning about what the body is doing and how it all works and why you shouldn't be afraid of it and kind of shifting the way that we view birth.
And I think in line with that, I would suggest hospitals, because if I look at hospitals, childbirth class, any one of them compared to like what you're offering, it's night and day, right? The hospital offers 1 day,
right? Yeah,
with hospital tour, and I want to say, who cares? You know, the hospital doesn't make any difference, right?
Yeah.
But if hospitals were to offer hypnobirthing, right, and have some options rather than just one type, it's true at all the hospitals I worked out of, and I don't know why people don't think, gee, is there a way to reduce C-section rate? Well, maybe hospitals aren't interested in reducing C-section rate because they don't make as much money. Who knows? I could be wrong.
To me.
Right? But so, you know, the one thing that we should help you is to get some of your clients who've done really well and let them talk to their friends and whatnot. Because I tell you what, it's really amazing to see these young women do something that I didn't think they could.
Yeah. Yeah. I mean, personally, my experience with it, I want to shout it from the rooftop of how amazing it was. I always joke whenever I go to a birth as a doula, I come home and I'm like, I want to do that again. I'm jealous. I want to give birth right now, just because it's just an amazing, mind-blowing experience. And for me, I'd give birth every day if I could.
Let's do that. Any last thoughts about anything?
You know, I appreciate you having me on here and allowing me to kind of share what hypnobirthing is all about.
I would love to have some of your clients come on together. We can talk about their experience.
That would be great.
Yeah. If you have any suggestions, let us know.
Yeah.
Thank you so much for listening. If you found today's information helpful, I really appreciate it if you leave us a review. That helps the podcast rank higher, and that means more women find this resource and improve their lives. Don't forget to subscribe, and we'll see you next week.